So today we will discuss about development of teeth. The epithelial lining covering the alveolar processes. We know that the maxilla is having alveolar processes, and so the mandible is also having the alveolar process, nothing but the upper border, and in the maxilla it is nothing but the lower border, right? So the epithelium covering the alveolar process, it becomes thickened. The epithelium covering the alveolar process, it becomes thickened and it grows into the underlying mesoderm. This thickening of the epithelium, we call it as dental lamina. Okay, this dental lamina, it shows localized thickenings. This dental lamina shows localized thickenings which grows into the underlying mesoderm. Here we have mesoderm and the epithelium covering the alveolar process of the bones, nothing but the mandible and maxilla. It forms a localized thickening. We call it as enamel organs. These enamel organs are 10 in number, 5 on each side. These enamel organs are nothing but the enamel organs. Okay, so what is dental lamina? The epithelium covering the alveolar process becomes thickened and grows into the underlying mesoderm. We call it as dental lamina. Then what happens here is this dental lamina shows a localized thickening. We call them as enamel organs. Totally we have 10 enamel organs are present. And here we can see this enamel organ, it becomes cup shaped. This enamel organ, it becomes cup shaped and it comes into contact with the mesenchymal cells. We call these mesenchymal cells as dental papillae. And see here from the lateral side of the dental lamina, some buds comes out from the developing enamel organs. These buds, they forms the permanent teeth. They forms the permanent teeth. These are nothing but these are the buds which further develops into localized thickenings or enamel organs. The same process repeats, and these buds gives rise to permanent teeth. Okay, now see here. So the enamel organ becomes cup shaped here, and here what happens is the cells of the enamel organ, nearer to the dental papillae, they become columnar. The cells of the dental enamel organ nearer to the dental papillae, nothing but the mesenchymal cells, they become columnar, and these cells are called ameloblasts. And the cells adjacent to the ameloblasts, the mesenchymal cells adjacent to the ameloblasts, they also undergo differentiation and they form one type of cells. They are called odontoblasts cells. Okay, so here we can see the cells nearer to the mesenchymal cells, the cells nearer to the covering the dental papillae, or mesenchymal cells, they differentiate into columnar cells. These cells are called ameloblast cells, and the cells nearer to the ameloblast cells, which are derived from the mesenchymal cells or dental papillae, they form odontoblast cells. So these are the above cells are ameloblast cells, these are the odontoblast cells. Okay, now what happens here is these ameloblast cells, they gives rise to a layer. These ameloblasts deposit one layer that is called enamel. The ameloblasts cells, they deposit one hard layer that is called hardest material that is called enamel. So ameloblast cells gives rise to enamel. So these ameloblast cells gives rise to enamel. The area which I have represented with dark black color is enamel. Okay, then what happens to the ameloblast cells is when the tooth erecting the gum, these ameloblast cells are degenerate. And they form a cuticle called dental cuticle. These ameloblast cells, they degenerate and form a cuticle over the enamel. We call it as dental cuticle. Okay, so these ameloblast cells are nothing but the enamel organ, which lies the mesenchymal cells which is at the dental papillae, they undergo differentiation and they call ameloblasts. These ameloblasts, they give rise to enamel, like the formation by layers and layers. Like in bones is also found by one layer is formed, and further that another layer is formed in bones in ossification. In similar, the ameloblasts, they form one layer, that is called, they form layer by layer, they form a hard substance, hardened substance. It is nothing but the enamel. And coming close to the odontoblasts, we know that the odontoblasts are derived from the dental papilla, nothing but the mesenchymal cells. The odontoblasts, they give rise to hard substance of the teeth, that is called dentine. These odontoblasts also they form, first one layer is formed like a bone, and another one layer is formed, and from layers and layers are differentiated and they form the hard substance called dentine. This is called dentine. So the formation of dentine and enamel separates the odontoblasts and the ameloblasts. Odontoblasts get separated from the ameloblasts by the formation of dentine. Okay, then what happens is, by the formation of this one, we call it as pulp. The mesenchymal cells here, they form the pulp of the teeth. They form the pulp of the teeth. As the dentine is forming and forming, what happens here is the pulp becomes narrow. Here the pulp becomes narrow and it is traversed by blood vessels, nerve plexus and various cells, macrophages. Okay, so this is traversed by, the pulp is traversed by nothing but the mesenchymal cells. The pulp becomes narrow and it is traversed by the blood vessels and nerve plexus. Okay, so these are the odontoblasts. These odontoblasts, they go on developing they go on forming the dentine until they go on forming the dentine and it forms the root. By forming the dentine, what happens here is the teeth goes deeper and deeper and the root is formed. Root of the teeth is formed. Okay, and here what happens here is the enamel it ruptures the gum. The enamel, it is called ruptures the gum. The part we can see in the mouth, we call it as crown of the tooth, which is present above the gum. We call this is the crown of the tooth. The part which is present above the gum, we call it as crown of the tooth, and the part here we call it as root of the tooth. So the dentine forms the most part of the root, and here the enamel which is formed by the ameloblasts, if these ameloblasts, they disappear and form a thin layer we call as dental cuticle over the enamel. And the these odontoblasts, they form the dentine. Okay, these are the dentine, which is the hardest substance, which is the hardest part of the bone, which is the hardest part of the teeth, like the bone. Okay, this is the pulp. This is the pulp which is traversed by blood vessels and nerve plexus. Here, what happens here is this dentine, it is covered by a layer of it is covered by hardest layer, that is called cement. Which is nothing but this cement, it is deposited by the cementoblasts, which are nothing but the derivatives of the mesenchymal cells, which are nothing but the derivatives of. So the root here, it is covered by a hard substance called cement, which is formed by the cementoblasts cells, which are nothing but the derivatives of the mesenchymal cells here. And also here another fibrous membrane is formed. Which connects the root to the bone, which connect the root to the alveolar process of bone. This one we called it as, outer to the cement we have another fibrous membrane is present, that is called periodontal membrane, which connects the root to the outside, root to the bone part, which connects the root to the bony socket. That is called periodontal membrane. So this is the development of tooth. Okay, first the epithelium or the alveolar process gets thickened and forms the dental lamina, and this dental lamina shows some localized thickness called enamel organs. So this is the dental lamina. This dental lamina shows localized thickness called enamel organs. From lateral sides of the dental lamina, they gives rise from buds arises from the lateral part of the dental lamina, and these buds, they give rise to permanent teeth. Here the formation of milky teeth we have seen. After that, These milky teeth, they gone off, they shed off and used from the buds, from the dental lamina, they gave rise to permanent teeth, and the process is similar here. Okay, and here see here, the from the cells of here we know that these are the enamel organ, and here the cells nearer to the mesenchymal cells, the enamel organ cells, they become columnar and they form ameloblast cells, which forms the enamel. On the cells nearer to the ameloblast cells, the mesenchymal cells, they differentiate to form another type of cells called odontoblast cells. They give rise to hard substance called dentin, and the mesenchymal cells, so further the remaining part of the mesenchymal cells, they form pulp, and this pulp is narrowed by the formation of dentin, and which is traversed by nerve vessels and blood vessels, nerve plexus and blood vessels, and also lymphatics. And here this is the crown which emerges from the gum. This is the gum, the part of the tooth which emerges from the gum, we call it as crown, and this is the root. And the root, it is formed by dentine, and the part of the dentine which forms the part of the root is covered by a layer called cement, which is formed by the cementoblast cells, which are nothing but the differentiation of the mesenchymal cells. And this cement, which is also further covered by a periodontal membrane. This periodontal membrane nothing but the fibrous membrane, which is also derived from the mesenchymal cells, this periodontal membrane which connects the root to the bony socket. So that's about the development of teeth.